Hello everyone, I am Dr. Prachee Kulkarni, Fertility Specialist, Ferty9 Fertility Center, Banjara Hills. Today I am going to talk about AMH. What can be done to increase the AMH level? Are there any treatments to increase the AMH level? And what fertility treatment you should opt for if your AMH is low? So what is AMH? The full form of AMH is anti-Mullerian hormone. So this is a hormone which is an indicator of the fertility potential or the egg reserve of a female. So usually when a couple visits us, we do some blood test to know the egg reserve or the fertility potential of the woman. So some of these blood tests are hormones. So AMH is one of the such hormones which will tell me about the egg reserve or the fertility potential of the lady. The other hormones, what we do is FSH, LH and E2P4, which we usually prefer doing on second or third day of the menstrual cycle after we rule out any ovarian cyst on scan. So some of these tests are period day specific, and also we have to rule out a presence of any ovarian cyst on the scan. Otherwise, this test will not be reliable. But AMH is one such hormone which may not show much variation based on the cycle day. So you can do this AMH blood test on any day of the cycle. But FSH, LH and E2P4 requires to be done after your scan and on second or third day of your menstrual cycle. So this AMH will tell me if your egg reserve is normal, or if it is suboptimal, or if it is very low, or if you have polycystic ovary, the AMH tends to be on the higher side. So the normal range of AMH hormone is between 2 to 4. So for ideal fertility or optimal fertility, means when you can try and conceive naturally, provided your husband's semen report is normal and your tubes are open, then the value of AMH what we look at is between 2 to 4. If you are having polycystic ovary, you have irregular cycles, you have some extrafacial hair and you have pimples, and you have consulted a doctor who has told you that your ovaries appear to be polycystic on the scan, then in the blood test what we suggest you is one of the tests is AMH. So if the AMH value is above 4, sometimes 6, 8, we have seen the values as high as around 18, 20, above 20 also. So such high AMH values are seen in polycystic ovary patients. So high AMH means polycystic ovaries, but we also have to confirm with other clinical findings and your ultrasound findings so that we can guide you for the fertility treatment. So this is high AMH. So what is low AMH? The value below 2 is considered as low. If the value is less than 1, then also definitely it is low, but we need to hurry up in our plans for conceiving, because that means that your egg reserve is depleting. So how this AMH drops down? So this is a normal process. So the females who start menstruating, they are going to lose a set of follicles or a number of follicles every cycle. Even though a female is releasing only one egg each cycle, there is a group of follicles which are present on second, third day. We call it as antral follicle count or AFC. So this entire group is lost in that particular cycle. So next cycle, what happens is another group of follicles which we can't see on the scan comes up to be seen on the scan. So these follicles are called pre-antral follicles. So what we see on the scan are antral follicles, which is a group which is available for that particular cycle. What we cannot see on the scan is pre-antral follicles, which is the store of the ovary. So why we always talk about antral follicles? Because it is indirectly representing your egg reserve or even the pre-antral follicles. Because if the egg reserve is good, if you have good number of stored eggs in the ovary, the antral follicle number will also be good. As you deplete your egg reserve, your antral follicle number is going to fall down. So this is a normal process. So every month you are going to lose a certain number of follicles, and this is how you deplete your egg reserve every cycle. And as you age, like usually after 30, this egg number, the follicle number, is going to drop down. Beyond 35, we call it, this is exponential fall in this AMH level and the follicle numbers, because most of the times after 35 there are other changes in the body, and this number drops down at a faster rate. So after 35, this AMH is going to drop down at a faster rate than less than 35 years. Sometimes even in younger patients we see low AMH levels or very low AMH level, like less than 1 or less than 0.5. So then these patients can probably have a condition called as premature ovarian insufficiency, or sometimes even early menopause. We call it as premature ovarian failure. So if you are having irregular late cycles, like delayed cycles, then also you have to get yourself properly evaluated from a fertility specialist to rule out the cause of this late cycle being low reserve or being PCOD. Because most of the times patient come to us saying that, doctor, we assumed or we were told that we are having polycystic ovaries, but actually when I did this AMH test, I came to know that it is not polycystic ovary but a premature ovarian failure. If I knew this before, maybe I could have had a good number of eggs to start the fertility treatment. So sometimes we see patients coming to us very late when they have actually completely exhausted their egg reserve, assuming that their irregular cycles are because of polycystic ovaries. So this has been seen many a times, and patients actually lose the opportunity to use their own eggs for fertility treatment when they are having irregular cycles because of premature ovarian insufficiency or lower side AMH. So if you have a lower side AMH, you should go for fertility treatment earlier than others, those who have normal reserve. So these AMH value, if there any treatment to increase the AMH. So actually, there is no such treatment which will increase your egg reserve or increase your AMH. But what we suggest is some adjuvants which are in the form of precursor of hormones, which we give for few months, 1 or 2 months before going for a fertility treatment like IVF. So these cannot be given for longer time because these are precursors of hormones which may not be helpful for your health or good for your health in long term. So we have to use these hormone or precursors of hormones for a short term treatment before going for a main treatment for fertility like IVF. Also, we give some adjuvants in the form of vitamins like folic acid, vitamin C, vitamin D, vitamin E, and coenzyme Q10 to improve the quality of the eggs. So these are certain ways of helping to maintain the egg reserve or helping to maintain the egg quality for the patients who have lower side egg reserve. But there is no such treatment which will drastically improve your egg reserve or increase your AMH value. So please consult the fertility specialist to know what is ideal treatment for you at your age and your AMH value, so that you can have pregnancy with your own eggs. If the AMH value is very low, like 0.01, 0.02, then the chances of conceiving with your own eggs, even in IVF, may not be very good. So in that case, there might be other options which are still experimental or not having a good result, but still can be tried, are going for treatments which use stem cells or platelet rich plasma for ovarian rejuvenation, that is injecting these PRP or stem cells or growth factors into the ovaries either laparoscopically or by ultrasound, so that you can try 1 or 2 cycles with your own eggs for IVF. Or sometimes if you have very low egg reserve, like we hardly see any follicles in the ovaries, AMH value is very low, then there might be an option of going for donor egg cycle for IVF. So these are the options when you have low side AMH reserve medically. There can be other things what you can do as a patient for yourself to support egg quality or egg number is to maintain healthy lifestyle by taking proper healthy diet consisting of good quality proteins, preferably plant based proteins, and also maintain good hydration. Take fresh fruits and vegetables in the form of salad in your diet, so that these antioxidants and vitamins will help in maintaining the egg quality. Try to get your weight under control. Each BMI near to 25 if you have, then the chances might improve. Also, if you have any other disease conditions like thyroid, diabetes, then keeping those conditions under control will also help in improving the egg quality and maintaining the egg reserve. So this is about AMH, and I hope this was helpful. For any queries or if you need any consultation, I am Dr. Prachee Kulkarni at Ferty9 Fertility Center, Banjara Hills. Thank you.